About a year and a half ago, we started analyzing the effect of healthcare reform on our health system, and came to the conclusion that healthcare reform will probably have a financial impact anywhere between $200 million and almost $1 billion. And so for the last 12 months, we've been working on a plan to improve our financial performance in order to be, continue to be very successful in providing great care to the community under healthcare reform. So that's the way. That's how it came to be.
How much does this actually, the plan, aim to save?
Annually, probably up to in year 5 about $100 million. Probably next year it'll save about between $50 and $60 million, and then it ramps up to $100 million in year 5.
And in the next decade, how much?
If you added it up cumulatively, it's about $950 million.
Can you tell us a little about some of the cost-cutting strategies that you're going to take within the health system?
To give you some examples, we're going to negotiate better with our vendors and decrease our supply cost by going to a centralized warehouse and negotiating better. We'll save about $8.5 million per year in year 5. There's some labor savings through consolidation, and about 60 employees will be affected by that. We will notify them over the next couple of weeks, and they will be eligible to look for other positions within our system, because we still have probably over 200 positions still open within our system.
And those who will end up losing their jobs, what will happen to them?
We have a very generous severance package for them. They would then qualify for unemployment in most cases. They continue to look for other positions within our system that may come open down the road, and we also give professional outplacement assistance to our employees.
Now, you guys made this decision to kind of save all this money because of the healthcare reform that is going to be put in place. Can you tell us what your opinion is on the healthcare reform and kind of why it made you guys decide to do all this?
I think healthcare reform is going to be positive for this country. I think the health industry is broken and needs to be fixed, and healthcare reform will be a big step in that direction. So I think most healthcare systems are going to have to go through a process like this. I think we're probably on the leading edge to get it done, because we want to be a leader here and make sure that we continue to provide great care, a great clinical quality, a great patient experience for those people who come to our hospitals.
What part of the healthcare reform has made you cut so much from the health system?
There's a lot of different places within healthcare reform that sometimes increases our revenues, but in many cases decreases our revenues. First of all, Medicare hasn't given an increase at all last year nor this year, and might go down by 2%. Medicaid also may be going down slightly. They also are implementing ACOs, and we have one of the first ACOs up and running in the area from a year ago, and the aim of ACOs is to reduce the expense of healthcare. One of the goals of ACOs is to reduce the expense of healthcare and improve the quality. By reducing the expense, they will probably reduce admissions and readmissions to hospitals, which will reduce revenues on the hospital side.
Anything else you want to add about the plan that's being in place?
We'll just say that I think Summa is on the leading edge of these changes in the healthcare industry, and we're doing it to make sure that we continue to provide great services. We've been here for over 100 years, and we will be here for another 100 years.